Welcome back to Buzz TV. I'm Howard Walpuff, your host. Jacksonville is a hotbed for the medical industry. We have tons of different types of medical businesses here, and to keep them going and to keep them moving correctly, we have the right IT companies to make sure all the software and all the technology is working correctly, and the right people are manning those technologies to make sure that you're getting the needs and information that you need. So today we're fortunate. We have Kyle Johnston and Zack Wilson from Weller Healthcare IT here to talk to us about exactly what they do and how they're keeping medical moving here in Jacksonville. Gentlemen, welcome to the Buzz.
Thank you.
So you've been at this for some time. How did the company get started?
So I've been in the business for over a decade now, mostly in the corporate world and staffing and consulting. Started in the IT sector and kind of entered into the healthcare piece when we saw meaningful use come along back in 2008, 2009, where the government mandated that hospitals be paperless. So there was a gold rush per se that all of these hospitals needed to start implementing an EMR, which is electronic medical record, going from paper charts to electronic charts. So when you go to the doctor, they're not holding a clipboard anymore. They're putting everything in a computer. So we do those large-scale implementations with healthcare organizations across the nation. We also support IT infrastructure, anything IT that's in a hospital, as well as we work with revenue cycle and do HIM, Health Information Management, which is kind of Kyle's sector, which is coding, CDI, audits, and education, physician education.
So you've been actually with the company since the beginning as well.
That's right.
So tell me about what you do on a daily basis.
So I'm in sales and I report up to Zack. And so my entire goal is to reach out nationwide to hospitals, insurance companies, medical groups, really understand their needs, where are they at in the process of their projects. As he mentioned, I'm specific to the revenue cycles in each of those different businesses. And so I'll speak to different contacts. And if they do have those large projects going on, then my goal is to make sure that I can get them the right staff to go in and finish those projects, which entails us being able to identify the right staff, having the process in play to make sure that they're good enough, and then manage them once they're on project to see those through completion.
So you work with different types of medical businesses. It's not just hospitals, but you're working for individual offices and large-scale corporations that manage healthcare.
That's correct. And a matter of fact, a lot of hospitals and healthcare systems, there's a lot of M&A or mergers and acquisitions going on out there. As those happen, IT needs are pretty relevant, as well as we do work with physicians' offices in smaller regional hospitals. And also a big piece, especially again in the revenue cycle side of things, is the payer side. So your insurance companies and large people that are doing massive coding projects, medical coding projects.
So with so many different changes that have come since that 2008, 2009 period, how often is it that you have to work on getting the softwares to communicate with each other as opposed to connecting the same softwares with an insurance company and making sure these pieces flow correctly?
All the time. It's healthcare is always changing. So as we, I always use the analogy, especially with an EMR, that they buy it, they get it in because the government mandated it, and they have to get it running. However, as things progress, they need to get all the bells and whistles. So we call it optimization. They start adding. I always say the car that had no sunroof and radio, and now they want the sunroof and radio.
Sure.
So, that's right. There's a lot of work that comes along with that, as well as if one system is on a specific product of an EMR, and they are acquired by one that was in a different EMR, then they have to switch the acquired hospital to that EMR or that system. So that a lot of work comes from that as well.
So obviously a lot of moving pieces, but putting together the right pieces and the right people to man it is really where you stand out, and that's the type of work that you are doing for these types of medical businesses.
Correct.
That's right.
So what is the best way for people to get in contact with you if they have IT needs or really want to get an overview of how they are operating?
So first would be our website, which is wellerhit.com, correct? You could also reach us at our office line. We are out at the beach. It's 904-385-4393. You can also find us on, of course, LinkedIn and Facebook. You just have to type in Weller Healthcare IT. You'll find us on both. I think it's good for our clients actually needing staff, but it's also good for the consultants that are looking for their next positions. So they can reach out to us and get in our network to make sure that when we have those staffing needs, we can put them in the right places.
Fantastic. And it's really good to know whether you're on the medical office side or the employee side that there is a resource here to make the right connections and find the right positions and find the right people for those positions.
That's right.
So thank you for all that you do, and we wish you the best of luck as time goes on.
Thank you.
Thank you.
Thank you.
This is very important to have the right type of companies managing your IT and your technology and software, especially in medical. There can't be any mistakes with this type of reporting. So definitely check out more information about Weller Healthcare IT on our website, jacksonvillebuzz.com. But go out, have a great time today, and we'll see you next time on Buzz TV.